Running does so much for me. It touches all areas of my life, my spirit, my health. I've run 61 marathons in my career, 7 in Chicago, and 38 consecutive at the Boston Marathon. My name's Mark Buciak. I live in Chicago, Illinois, and I'm a running coach. When I was 45 years of age, I was diagnosed with AFib and a leak in my aortic valve. I was obviously surprised and shocked, especially because I had no symptoms whatsoever.
Athletic training and exercise is not an immunization for developing heart problems. Athletes, like anyone else, can develop a heart problem, and it is actually relatively common in the population. Mr. Buciak had atrial fibrillation and a bicuspid aortic valve. Bicuspid aortic valve is a congenital heart condition.
In general, about 20 to 30, maybe even as much as 40% of patients with valvular heart disease also have atrial fibrillation. Atrial fibrillation is a condition where the upper chamber of the heart starts to beat in an uncoordinated fashion, and it starts to send irregular beats to the rest of the heart. The main risk with atrial fibrillation is that of a stroke. About 20% of patients who have stroke have atrial fibrillation.
The doctor told me we would monitor my condition with tests several times a year.
A common test that we use is something called a stress test, which is where a patient gets on a treadmill and we're monitoring their heart. We really push the heart to its limit under a controlled condition, and through multiple means, really evaluate how the heart is functioning.
My cardiologist told me it's time to see the surgeon after he looked at the recent echocardiogram.
So we elected to treat it by replacing his valve, as well as giving him what's called a maze procedure, a procedure to treat atrial fibrillation.
A maze procedure is a treatment where we try to isolate the areas that cause the atrial fibrillation to prevent them from propagating those irregular beats to the rest of the heart. There's a growing body of evidence that shows that patients with valvular heart disease and atrial fibrillation do better if they have their atrial fibrillation treated at the time of their valve surgery. It is important for patients, I think, to go to centers that can offer either a surgical valvular treatments as well as a maze procedure, or a combination of percutaneous transcatheter approaches as well as EP ablations.
Knowledge is power, particularly at Northwestern Medicine. Their track record is superb. Their outcomes is some of the highest in the nation. Everybody recovers from surgery at their own pace. So returning to running after heart surgery meant a tremendous amount to me. That was my real final exam, that I was able to go back on track. 11 weeks after my open heart surgery, I completed my 27th Boston Marathon. As a matter of fact, it was my personal slowest race, but it was my personal best ever. Things are measured more than just by time.
Mr. Buciak is doing great. He's continued to run marathons every year. His valve is functioning very well. His atrial fibrillation is very well controlled. He's doing terrific.
One of the most important things I've learned is it is up to the patient to take care of themselves initially. Knowledge is power.